Imagine this. You're enjoying a peaceful night's sleep when suddenly a sharp, intense pain shoots through your calf. Your leg seizes up, hard as a rock, and you're jolted awake. You've just experienced a muscle cramp, a common and often agonizing ordeal that can strike anyone, anytime. While usually harmless and temporary, cramps can be disruptive and debilitating, leaving you wondering what caused them and how to prevent them from happening again. In this exploration of muscle cramps, we'll delve into the science behind these involuntary contractions, uncovering the common causes, risk factors, and triggers. We'll equip you with practical tips for prevention and provide clear, actionable steps to find relief when a cramp strikes. By understanding the mechanisms behind muscle cramps, you can take charge of your muscle health and minimize the chances of encountering these painful episodes. Muscle cramps are involuntary, forceful contractions of a muscle or a group of muscles. They typically occur suddenly, causing a noticeable hardening of the affected muscle. The pain can range from a mild tightening sensation to intense, debilitating agony. While any muscle can cramp, cramps most commonly affect the legs, especially the calves, hamstrings, and foot muscles. These cramps often occur during or after physical activity, but they can also strike during periods of rest, even waking you up in the middle of the night. Although the exact mechanisms behind muscle cramps are not fully understood, several factors contribute to their occurrence, and understanding these factors is crucial for effective prevention and management. One of the most common causes of muscle cramps is dehydration. When you're dehydrated, your body loses fluids and electrolytes such as sodium, potassium, and magnesium. These electrolytes play a vital role in muscle function, helping to regulate muscle contractions and relaxation. When electrolyte levels become imbalanced due to dehydration, your muscles can become more excitable, making them prone to cramping. This is particularly true during exercise, as sweating further depletes your body's fluid and electrolyte stores. To prevent dehydration-induced cramps, it's crucial to stay adequately hydrated throughout the day, especially before, during, and after physical activity. Drink plenty of water or electrolyte-rich beverages such as sports drinks or coconut water to replenish lost fluids and electrolytes. Section 4. Beyond dehydration, exploring other causes. While dehydration is a major contributor to muscle cramps, it's not the only culprit. Several other factors can trigger these painful contractions, including overuse. Putting excessive strain on your muscles, especially during prolonged or intense exercise, can lead to muscle fatigue and cramping. This is particularly common in activities that involve repetitive motions. Poor blood flow. Inadequate blood flow to your muscles can deprive them of oxygen and nutrients, making them more susceptible to cramping. This can occur during exercise if your muscles are not getting enough blood supply or if you have underlying conditions that affect circulation, such as peripheral artery disease. Electrolyte imbalances. Even if you're not dehydrated, an imbalance in electrolytes, such as low levels of potassium, magnesium, or calcium, can disrupt muscle function and lead to cramps. These imbalances can result from dietary deficiencies, certain medications, or medical conditions. Nerve compression. Compression of nerves that travel from your spine to your muscles can also cause muscle cramping. This can occur due to conditions like spinal stenosis, where the spaces within your spine narrow, putting pressure on nerves. Identifying the underlying cause of your cramps is essential for effective treatment and prevention. If you experience frequent or severe cramps, consult a healthcare professional to rule out any underlying medical conditions. Section 5. Risky business, factors that increase cramp likelihood. While anyone can experience muscle cramps, certain factors can increase your risk. These include age. Muscle cramps become more common as you age, likely due to age-related muscle loss and reduced circulation. Pregnancy. Pregnant women are more prone to cramps, particularly in the legs, due to hormonal changes and increased pressure on blood vessels and nerves. Medical conditions. Certain medical conditions, such as diabetes, thyroid disorders, and liver disease, can increase your risk of muscle cramps. Medications. Some medications, such as diuretics and statins, can have side effects that contribute to muscle cramping. Alcohol consumption. Drinking alcohol can dehydrate you and deplete your body of electrolytes, making you more susceptible to cramps. Understanding these risk factors can help you take proactive steps to prevent cramps. If you have any underlying medical conditions or concerns, consult your doctor for personalized advice. Section 6. Prevention is key keeping cramps at bay. The good news is that many muscle cramps are preventable. By adopting healthy habits and taking precautions, you can significantly reduce your chances of experiencing these painful episodes. Here are some practical tips. Stay hydrated. Drink plenty of fluids throughout the day, especially before, during, and after exercise. Water is generally sufficient, but electrolyte-rich beverages can be beneficial during prolonged or intense workouts. Eat a balanced diet. Consume a diet rich in fruits, vegetables, and whole grains to ensure adequate intake of electrolytes, such as potassium, magnesium, and calcium. Consider talking to your doctor about whether a magnesium supplement might be right for you. Stretch regularly. Stretching before and after physical activity can help improve flexibility, reduce muscle tension, and prevent cramps. Focus on stretching the muscles you use most frequently. Take breaks. Avoid prolonged periods of sitting or standing. If your job requires you to be in one position for extended periods, take regular breaks to move around and stretch your muscles. By incorporating these preventative measures into your routine, you can create a proactive defense against muscle cramps and enjoy your activities with greater comfort and confidence. Section 7. Cramp relief. What to do when they strike. Even with the best preventative measures, cramps can still happen. When a cramp strikes, the following steps can help alleviate the pain and shorten its duration. Asterisk, stop your activity. Cease the activity that triggered the cramp if possible, and gently stretch the affected muscle. Asterisk, massage the muscle. Use your hands to apply firm pressure to the cramping muscle, which can help relax the muscle fibers and improve blood flow. Apply heat or cold. Applying a heating pad or warm compress can relax tight muscles, while applying an ice pack can help reduce inflammation and pain. Hydrate and replenish electrolytes. Drink water or an electrolyte-rich beverage to replenish lost fluids and electrolytes. Most muscle cramps are harmless and resolve on their own within minutes. However, if you experience frequent or severe cramps, cramps that last for an extended period, or cramps that are not relieved by home remedies, consult a healthcare professional to rule out any underlying medical conditions.